Hi, and welcome to our fourth session of our online spring trek. I hope you've had a great Sunday so far, and looking forward to tonight's conversation. It's between Sue Montgomery, who's the Director of Prayer Counseling here at West Highland, and in this interview, she interviews Paul Stimers, who's a deacon at West Highland and is also a registered psychotherapist. In this interview, they talk about various aspects pertaining to mental health during COVID-19 in this pandemic we find ourselves in. And so I trust you'll find this session helpful. And so here's the conversation between Sue and Paul on mental health.
So today I have with me for our TREC session, I believe this is going to be our fourth TREC time together. And so I'm so glad that you've decided to tune in and join us. And I'm so glad that I have our guest today with me, and that's Paul Stimers. Paul Stimers, for many of you, you know him as a fellow member at West Highland, and also you know him as a psychotherapist who is working hours out of our church building normally, as well as another counseling center in Halton. And so welcome, Paul. I'm going to give you a chance to say a little bit more about yourself so that there may be people who are not familiar with you and your family. But for those who are, you know that Paul is married to Kristen. And between the two of them, they're very active at our church. Kristen's been involved with the women's ministry and with the kids, with all of our Star Kids programs. And Paul, you and I have had a lot of discussions and shared work together because you're the deacon of prayer counseling. And I think usually on Sunday mornings when we were gathered together, I would see you often there because you're involved with the ushering as well.
That's right, yeah.
Okay, can you fill us in a little bit more, maybe about your family and just your time at West Highland, and as well about your professional work?
Yeah, thank you. And it's a privilege to be here. Hello to all of you watching. It's a great privilege to be able to speak to you about these things. As Sue said, my wife Kristen and I have been attending West Highland now for just over 10 years, coming up on 11 years. And we have 3 kids. Our kids are well, they'll be 11 this year. So we have 3 almost 11-year-olds in our home, and they keep us pretty busy. And so, as Sue said, I'm a registered psychotherapist. So I do counseling and therapy with folks. And I have a couple of different roles in that. I work in Halton region as a clinical supervisor at a children's mental health center there, where we're pretty busy. And I do some therapy and some supervision of staff there, as well as develop programs. And then I have my own practice as well. As Sue said, I often use space in the church, which I'm grateful to be able to partner with the church to provide support and counsel to folks who need it. I provide workshops, and I supervise other therapists in the community as well, and in some of the work that they're doing. So that's a great honor for me to be involved in people's lives, and it's been a privilege to serve as a deacon now for a couple of years, and to support the work you guys do, Sue, in the prayer counseling ministry, and also just provide support to other ministry team members as I'm able. So that's been a great joy and honor for me.
Yeah, and we for sure have appreciated many times as a staff Paul's input on a lot of different matters, actually. But it's been great to be able to have your professional advice on a lot of different situations where we find ourselves. So thank you again. Mm-hmm. And so just for those of you that have tuned in, we're going to be dealing with just a very bird's eye view level of some of the mental health issues and the conversations that are happening during this time of COVID lockdown. And I recognize that at the time that we began talking about this issue, Paul and I, that some things have already changed from the time that we first started having these dialogues. But the concerns about mental health and how people are doing at all of the different stages of lockdown are they're not diminishing. And so we wanted to talk about a few different things. We've broken it into some categories. But Paul, maybe you can start by just giving some thoughts about, it seems like as COVID lockdown in its varying levels has kind of dragged on, often at first we heard a lot of feedback from people that they were having a hard time even putting words to it, but it seems like it was more anxiety for sure about health concerns and other, financial concerns. And then there was so anxiety, but then also like a fatigue and maybe even loss, grief.
Mm-hmm.
One of the interesting articles that we looked at as a staff, and you've mentioned as well to me, is there was an article written by Kurt Thompson, and it's called A Body of Work, and it talks a lot about the stages that we've been going through. And so I'm wondering if you can comment on that, because he says that actually over the last 3 to 4 weeks, there's been a shift, that we've undergone a shift with all of the Zoom things and everything online, and people being, working in different, totally different contexts, sometimes with tons of people around, sometimes totally alone, that we've had a shift where the predominant feelings have moved maybe or added to from anxiety and loss to irritability and anger. Is this happening? And if so, why?
Yeah, it's a great question, Sue, and it's a great article by Kurt Thompson, who's a medical doctor and a Christian, of course. Very insightful article. And you're right, the concerns aren't diminishing, but they are changing. And so that's important for us to recognize, I think, as a community. And we did, at the beginning of the pandemic, I had a number of meetings with various churches about how to name grief and loss. We were all experiencing the loss of a lot of things, and a lot of us weren't sure how quite to put words to it and how to make sense of some of those emotions we were going through. But you're right, as the weeks have gone on, the conversation has started to change a little bit. And I'm happy this evening to talk with you about a few different ways we're noticing that happening as we go through some of the different categories we discussed. But we are noticing a shift in terms of anxiety moving into anger and irritability. And really, I think what's happened is we had this initial fear of the virus. We were afraid of getting sick. We were afraid of our family members getting sick. And a lot of us were afraid of, what's going to happen with all of this. And then all the limitations came in. The lockdown started to happen. Businesses started to close down. And we began to kind of become very isolated at home. And so what happened, I think, with that is we started to notice the financial pressures. Our relationships began to change. And our general sense of mobility really was significantly impacted. Even going to public spaces like parks and other recreational areas was impacted by this. And Kurt Thompson, I think, rightly noted that we have this God-given desire to be mobile and to be able to move around and experience different things. As humans, I think we crave some diversity and novelty in terms of our stimuli, right? The things we see and feel and taste and experience. It's partly why we enjoy travel, because we get to see something that's different and have different relationships and observe different things. And so as we've kind of gone through this pandemic and we've become isolated, all of that stuff has been removed, or at least largely removed from us. And so the longer those limitations are in place and the more our mobility is impacted, the more we start to see symptoms coming up for folks. And I'll elaborate a little bit on what Kurt Thompson didn't talk about, but what's helpful to think about is our own window of tolerance, if you will. So if you think about it, kind of a general window of what I can tolerate in terms of stress, what we see the longer this goes on is we either reach the upper limits of that, or on the other hand, we deactivate and we hit the lower limit of our window of tolerance. And so Kurt Thompson talks about how our fears and anxieties turns into anger, which is kind of an activating. It's kind of like the top of that window of tolerance. But many folks are also hitting the bottom of that window of tolerance, and that tends to look more like a lethargy and apathy. And so we actually see a shutting down, if you will, of who we are as people. And so I think that's where we start to notice those things happening. Now, in both cases, I think what's going on is we're feeling powerless over our circumstances. You know, there's a lot of things we can't do, and we're told not to do. And that sense of powerlessness is only tolerable for a short period of time before our spirit becomes restless and we start to crave something different and we want to go back to what we were doing. I think most of us, even this week, have seen the protests that are happening in the States. And it comes out of this sense of powerlessness, the injustice and the unfairness of things. And we see people reaching the limits of their window of tolerance. And at extremes, of course, we see lots of, violence and things, which of course, we don't condone. But it's a way of understanding that sense of powerlessness and how we want to overcome it. And so we're pushing for change in our bodies, in our emotions. And I think our job as people, and certainly as Christians, is to figure out, how do I express this and manage this in a healthy way, and not in an unhealthy way, as we've seen in the news and things like that. So I think that's where we're going with some of the emotions we're experiencing at this point.
Mm-hmm. No, that helps a lot. Along that line, can you comment maybe a little bit more detailed on why, for a lot of us, a lot of people have had to stay home and do everything by video conferencing. They're on their laptops more than ever. Sure, there's phone calls, but nothing is in person. Even with our kids, children are now doing everything online, even more than they did, which is incredible. So I'm just wondering, why do those things seem so tiring and exhausting when, I thought about it myself. I'm thinking I'm not driving anywhere. I don't have a lot of other social interaction to sort of navigate or tire me out. Why is sitting in front of a computer so hard?
Yeah, it's a great point. There's a lot that's been written. I'm sure a lot of people watching this interview are familiar with some of the articles that have been out there. But some of this isn't new, as you say. Especially our young people are quite accustomed to being on technology, and we're aware. I think now most of us are aware that the light that comes off of our technology is really stressful for the eyes, especially over long periods of time. And so we know that causes in itself some mental fatigue. It's also very stimulating for our brain. And so especially closer to bedtime, that blue light that comes off of our computers, it has our brain activated longer than we actually think. So those things aren't new to us. We've known that now for a long time. What's newer for a lot of us as we interact with people, and we're not just watching TV or for young people playing video games, we're now interacting, as you say, on Zoom, and you and I were getting this all set up, and we're paying attention to a lot of things, aren't we? I mean, we're paying attention to the lighting, we're paying attention to how we look, and we're not accustomed to doing that in person. Right. We're much more self-conscious, I think, now that we see ourselves on screen. I've certainly seen more of my own face, I think, in the past couple months than I ever have. And so it makes us hyper aware of those things, which is quite novel for us. And the other thing that we've really taken for granted, I think, is that a lot of our communication with people is nonverbal. And so studies have shown that, 80 to 90% of our communication, we actually pick up, more through our senses, more through how we feel being with somebody than what the person's actually saying. And when we're not actually with people, we have a lot less access to those nonverbal things. And so we're limited. And so our brain is actually paying attention more to people than we're used to. We're reading facial reactions, much more than we have in the past. And so we're really attuned to those things, and our body's kind of picking that up, and it's fatiguing. So where we might just get together and you and I might sit down in person and we feel like our bodies relax a little bit because, we know each other, we're comfortable, and we kind of ease into a relationship. In newer relationships, we might feel more tension, because we're naturally trying to sort out, is this person somebody I'm going to be comfortable with? And so I think intuitively we all know that feeling, but online this is much harder to do. So we're much more self-conscious, and that's much more draining emotionally and physiologically than I think most of us anticipated.
Mm-hmm. No, that makes a lot of sense, actually. A lot of sense. Yeah, thus I need a new prescription for my glasses. Well, I guess on the positive, what things can help? Like, what would you suggest, either from this article or other things that you are familiar with? What's helpful?
Yeah, I mean, there's a number of things. Physiologically, we have to be aware of our posture. I think a lot of people are realizing the longer we're sitting at our desks and computers, the more, our body's feeling the aches and pains of that. And so, I've seen a lot of encouragement from businesses and in the literature over the past couple of weeks to have more movement. If you can do calls that are audio and walk and move rather than being on screen all the time, there's a lot of value to that. And we've also been exploring, I think, changing environments. Moving from room to room, changing which room we're working in. All of that kind of helps our general kind of stress level. It provides a bit of novelty where we can. And the other thing I think we're moving towards now, and I'll speak more about this in a few minutes, but we're moving from kind of our stable routines to diversifying our day. And this is kind of an interesting, I actually had a person I was speaking with the other day that used this term, that they were diversifying their day. And by that they meant that there was a routine and a structure and a predictability that was starting to become pretty monotonous. And so at this point, in our pandemic situation, we need to be thinking about how do we mix that up a little bit? How do we begin to diversify the activities so that we're practicing restorative practices here, that we're not just getting stuck in a rut, and that we're moving forward. So limiting videos certainly helps. But Kurt Thompson talks about this. He talks about how integral our body is. Now there's a lot of kind of theology around this, but you can see this in the Psalms, for example, that, David talks about, expressing emotion to the Lord, but he also engages his whole body. We see the singing and the dancing and the music and the rhythms, and all of those things are actually really integral to helping our body, process emotion and decrease stress and move forward. So I'll talk more about that in a little bit in terms of how we manage stress, but all of those things are, I think, important to consider as we're being intentional about moving forward. And the other thing I personally think is really important is contemplative prayer. And I think we all have different, maybe routines or ways that we engage the Lord in prayer. But I think as we're wrestling through some of our emotions and we're seeking to hear the Lord, to engage in our own personal worship and singing at home, as well as engaging in meaningful prayer.
Good. Yeah. Thank you very much. Of course, that's an opportunity I don't want to miss in terms of just what we're seeing within the prayer ministry, is that at this time, people are, it seems, a little more willing to lean into some different disciplines or different, styles of prayer where they can be more contemplative. So yeah, thank you for mentioning that. I think one other thing too, within the Thompson article, kind of made me chuckle because, I'm pretty introverted by nature. And so he says, if you have occasion to be outdoors or, going into stores or whatever, greet as many strangers as you can.
Yeah.
And it's been kind of humorous because I've been doing it very purposefully. And it's actually kind of funny. I'm thinking, oh, well, maybe I'll change some of my habits when I'm out of COVID.
I think it's a great point, Sue. I've had a number of people that I've been working with where they've noticed as they've gone on walks in their own communities and tried to get some fresh air that, people cross the street when they see you approaching. They're avoiding eye contact. You get sideways glances from people, and they've spoken to me around how that feels, just to feel like even if you're healthy, people are approaching you as if you're sick. And the impact that has on us emotionally, to have people crossing the street when we come. is sometimes more significant than we think.
Mm.
And now as people are getting accustomed to wearing face masks and things like that, it's much harder to see people's faces. You know, we're reading eyes, but not a whole face.
Yeah.
And that becomes challenging as well. So, you know, I have a colleague that works in a hospital, and they have to be gowned, gloved, and face masked and everything else in the unit that she works in. And she talks about how different it is to walk through the hall. She's naturally a very smiley person, and no one can see it. And she's trying to figure out, how do I smile with my eyes so people know that I'm being friendly? That's a real challenge for us. And I think it's a great practice for us to be greeting people, smiling as we're able, and trying to be friendly. I really think it makes a difference, especially in this pandemic.
Mm-hmm. Yeah, good. So I just kind of moving along, I mean, because our restrictions are lightening up just a little bit, and our communities are kind of going to move forward in terms of like recovery efforts. I mean, we saw some extra businesses being allowed to open. I'm pretty sure in terms of counseling centers, they were given a sort of green light with a lot of protocols, and not all of the centers are taking advantage of that.
Mm-hmm.
So based on the fact that we're starting to see these types of things, and eventually there's going to be regrouping of people, I know at the church we've been starting to talk about, you know, regardless of timing, what might that look like? There's going to be some real changes, probably in every area, right? Economically, travel, in terms of what people can expect for like celebrations and gatherings. From a mental health perspective, how do we need to be thinking about these things? Like what can we be doing, I guess, to prepare? Because already in thinking through probably like your counseling center office and the church opening, I mean, on one level, there's protocols and things that have to be worked through logistically. But on the other hand, there's this people category where regardless of the protocols, there's going to be all kinds of varying levels of comfort.
Mm-hmm.
And how do we think about this going forward? How do we prepare?
Yeah, it's a great question. I think there's a lot that could be said on that, but for a moment, I want to paint a bit of a bigger picture about this before we get down to something that's a little more practical. I think big picture, what we saw was we were initially in an emergency phase. You know, we were managing a crisis, and we all went into crisis mode. And from a mental health perspective, I think a lot of people were seeing a lot of discussion and encouragement to create routines and structures. And many of us transitioned our work home, and some had to adjust in the community if they had to continue to work in the community. So there was a lot of adjustments being made. And so we made those adjustments, and we encourage people to develop those routines and habits, and not to stay in their pajamas all day and those kind of things, because it's good for our health to keep going with some good habits for ourselves. But we've moved out of that phase, and we've moved into another phase during this pandemic that might be called a regressive phase. And this is interesting to observe sort of at a larger level, that we've moved out of the panic. You know, we saw everyone buying toilet paper like crazy. We've largely moved, not all the time, but we've largely moved from that. Still hard to find yeast sometimes. But we've moved past that now, and we've kind of engaged in a waiting phase. You know, we're watching the news, we're waiting for things to reopen. And, you know, the assumption, I think, by people has been that this actually should be less stressful than the first phase. But in fact, it's more stressful for people. There was some research done a couple of years ago by the United States military, and they were watching stress levels for the soldiers and other people that were involved in combat and military exercises. And they were monitoring their stress, and the assumption, I think, was that during combat or during their missions, that they would be more stressed than when they were at home or when they were training, when in fact the opposite was true. The studies actually showed that when people were on mission and they were in combat, there was adrenaline that kicked in. They were purposeful, they were focused, they had something that they were really paying attention to. And that was our state, I think, in the first couple of weeks of the pandemic. We were trying to figure out, what do I need to do to cope? How do I get through this? What needs to happen next for my work and for my kids? And so we were focused on those things. And then we began to name the grief and loss that happened. And then we entered into waiting. And so now what we're seeing is that there's a monotony to that. There's a boredom that kicks in. We're lacking new experiences. We're not using our skills the way we used to. We're not interacting with people the way we used to. And so this actually becomes much more stressful physiologically. Now, in terms of our own physiological stress response, it's important for us to remember in this kind of waiting period the impact that this has on our bodies, so that we can then figure out what to do about it. So, you know, when it comes to stress, there's a positive level of stress. You think of writing an exam, for example. You know, we know that stress is there, and so we prepare and we focus, and the stress actually helps us achieve what we're trying to achieve. And then there's a tolerable stress that's sometimes a little bit more prolonged, but we hope it doesn't last too long, right? And so there's a tolerable stress, and then there's what we call toxic stress, which is kind of a chronic stress that doesn't seem to lift. And when we're moving from a tolerable stress to a toxic stress, it really takes a toll on our body. And the neurochemical impact of that is actually quite profound for our whole body. So, you know, for example, our skin will be impacted. We're more prone to rashes and acne and eczemas. Our heart, we know our heart changes under stress, right? We know our blood pressure goes up. We become, our cholesterol goes up. We're more at risk of heart attack and stroke. Our pancreas actually increases the amount of insulin. So we become more prone to diabetes and things like that. Intestinally, our metabolism actually slows down. So we don't absorb nutrients the way that we do otherwise. And so we become more prone to, you know, weight gain and appetite changes.
That's bad news.
It is bad news for a lot of us, especially when the kitchen's a lot closer for most of us. Our reproductive system changes. Fertility goes down, arousal goes down. Our immune system actually slows down as well. And so we become less effective and less efficient as we try and manage illness. And then, of course, from a mental health perspective, we know that prolonged stress and chronic stress impacts our mood. It makes us irritable or depressed or anxious. Our energy drops. Our focus, our concentration becomes a problem. And so the effects of stress are actually quite immense when we think about it. So we need to be kind of regularly trying to assess, you know, how stressed, am I seeing any of these symptoms in myself that might be alerting me that I need to make some changes. And so that's all that kind of dangerous phase of the regressive period, that our bodies are really reacting to this in a tough way. And so, well, what do we do? I mean, really what we want to do is notice when we're in this regressive phase, and we want to try to move towards a recovery phase or a resilience phase. And this takes a little bit of thought for us to figure out how we're going to do that as a church, as a community, as families. What do we need to be doing to alleviate stress and then move forward? And so the way that we're thinking about it, certainly as organizations and businesses, is not how do we go back to what was normal. You know, we're not going to go back to normal. Businesses are changing. The employment landscape is changing because of this. And I think it's becoming more and more clear that that there are going to be long-term impacts of this, that there's not just going to be a date where we all say, okay, hooray, we all go back to work the same way we used to. The world is going to look a lot different for businesses, for travel, and for how we go about our lives. So we need to make sure we're not getting down on ourselves and being discouraged about that, but thinking about what's next. How do we innovate? How do we become flexible? And how do we move forward in a way that's meaningful to us? Relationally, in church ministry, in our businesses, you know, those are some forward-thinking things we need to consider.
And so do you have any, I mean, are there things that personally you think would be helpful in terms of us? I mean, let's take, for instance, if we just focus in on the church and our Christian brothers and sisters, and you know, are there things that we should be thinking about in just our framework of one day getting, you know, into graduated stages of returning?
Yeah, I don't know that I can really scaffold, how the church is going to get back together. I think, as a church, we need to think about that, especially a church our size. We'll need to think about how we go about that. But as individuals and families, I think there's a few things that we can be working towards, both in terms of, what's happening in our bodies under stress, as well as emotionally what we can do. So I'll give you kind of 3 ideas that I've been thinking about this week about that. The first one is to disrupt our routines a little bit. So not to get rid of our routines altogether, but we're trying to move from stabilizing our lives to mobilizing our lives. So we want to try to start to engage in ways that we can. We want to start to engage with people in our communities, a little more and more. Now I'm not encouraging anyone to break rules and, become scofflaws and those kind of things. But we need to start developing a bit of comfortability engaging with our communities a little bit more. Because the longer we wait, the more the anxiety is going to be there about going to stores and interacting with people. So little bits we need to start taking steps that direction. And as we do that, it's going to invite us to recalibrate our emotions. We're really going to have to pay attention to how it feels to be, moving in that direction. And when it comes to managing emotions, I think it's helpful for us to consider how God has scaffolded our brains, if you will. So without making this too technical, our brains tend to develop from the bottom up. Okay, so you think about a baby. When a baby's born, the brainstem develops first, and the brainstem is largely responsible for all of our unconscious physiological things. It controls our blood pressure and our breathing. Things that we don't we don't think about. Most of us don't think about, oh, how's my blood pressure doing right now? How do I make it go up or down? This is largely happening outside of our consciousness, and our brainstem is responsible for that. And on top of the brainstem develops the limbic system. And the limbic system is responsible for our attachments and our relationships with people, our emotions, and much of our behavior. And between the two, we start to get that fight, flight, or freeze stuff that happens, right? So all of that's sort of in the lower part and mid part of the brain. And then on top of that comes our cortical system. And that's responsible for our thinking, analysis, our ability to inhibit behavior, our ability to learn, and things like that. So if we think about the brain being scaffolded that way, we can then understand why sometimes when we're having a lot of emotions, why it's hard to think about decisions. We know that when people become anxious or depressed, it becomes very hard to make clear decisions. And so we know that experientially. In the brain, that's why it's happening. So we need to find a way to calm the brain and calm those lower parts of the brain so that we can then engage with the higher levels of thinking and planning. And so the way we do that, if you think about even what we've done with infants, for those of us who have had kids, we know that when babies are upset, we naturally rock them, right? We take them in the car, and there's something soothing about that kind of movement, the hum, right? We might pat them as we're holding them. As I can remember when my kids were little, you're bouncing them a little bit, you're rocking them, we sing to them, we move their arms back and forth, we wiggle them a little bit, right? We encourage them to play with rattles and tactile things. And we do this intuitively because that part of our brainstem and the limbic part of our brain needs sensory things to regulate it. And so, at a really basic level, some things that calm us are just having music. Being able to sing is actually really important. I think this is God-given. I think God gave us the ability to sing with one another, to praise God, yes, to worship, but also because it's an expression of what's happening inside of us. And I think God has designed that in a beautiful way to help us regulate what's going in our bodies. And I think that's so important. So we can do all those things to settle our level of stress, anything tactile. It's why some churches and other traditions will use incense and things like that, because they're engaging the senses as a way of kind of resetting and focusing us. All of those things kind of help settle our body when we're stressed. And then we're able then to process our emotions. And so again, as families and as individuals, we want to be naming our feelings and naming our grief and loss and naming our anxieties, bringing them to the Lord, and working them through, right? Not letting ourselves become captive by our feelings, but really trying to work those feelings through so that we're not holding all that emotional stress. And that's where, having trusted friends and family to talk to is really helpful. Certainly prayer, is really helpful. And when we need it, that's where, places like prayer counseling and professional counseling like myself, becomes helpful to give us a place to talk and process our feelings so that we're moving through them and not getting stuck. So if we're doing those things, we're finding adaptive ways to cope. And then we're able to avoid sort of the maladaptive things that we see and hear sometimes in terms of substance use and other things that are happening for people who are struggling to manage the rest of those things.
Yeah, no, thank you very much for expanding on that, because there's, I'm sure for everybody, a few little takeaways that, it just made sense as soon as you said it, that, okay, this is something that I can be more intentional about. And I think too, for people who have tuned in specifically because we were talking about mental health, I like the fact that you've tied a lot of it to our physical body, and everything from singing and music to movement, in terms of taking care of the whole of who we are. So yeah, thank you. Just to kind of head that way a little bit more in terms of mental health, and this would be, I guess, a question broadly. There was a recent study, I know, by the Ontario division of the CMHA, and they were suggesting that Ontario for sure is going to need to brace for a mental health crisis. I think in some people's mind, we were already there. But in terms of what's going to be the fallout, some people are experiencing varied levels of what I would call trauma in terms of, maybe not being able to process after a death in the family and not being able to be together, and routines out of order, everywhere from that through to financial crisis. Yeah. And so, what is your thoughts about that? I mean, as our province and our world actually moves through this crisis, is this something that you're concerned about? What are you seeing in your professional circles? What is real?
We are concerned about it. We are, there's been a lot of advocacy for mental health during the pandemic, and for those who are unaware, most mental health services are continuing and are available. Of course, we've been encouraged to use virtual services as much as possible so that we're, not increasing people's exposure to virus. But most, if not all, services are continuing. So that's important for people that are waiting for support to know that it is there. But we are concerned as things open up, the impact of this. And I think you've given some great examples, for people who have experienced death. A lot of us have lost people during the pandemic. Our family is included. And to know how to grieve is a challenging thing when we can't gather together as we do. And so that's a struggle. The financial impact is certainly a struggle, and we know economic recovery is going to take a long time. So that's not something that's going to go away as soon as businesses reopen. Those are things that are going to continue for an extended period of time. And then, of course, in families and in relationships, we have seen an increase in mental health and all sorts of violence and abuse, unfortunately. I know in California, a doctor reported last week that in a 4-week period, they saw more completed suicides in that month than they had in an entire year. And that's devastating. Mm-hmm. That's devastating. People are really suffering from this, and it's going to continue to be a challenge. Here in our city, there's a number of people that we have heard from and colleagues of mine that work in shelters and women's centers, where they've heard from a lot of people that say they are reluctant to come to a women's shelter for support and housing because they're worried that they'll be exposed to the virus. And so they're staying in relationships where there's family violence happening, longer than they might have before. And so we know that at some point our restrictions will lift and we will start to engage in our community again. But the effects of these traumas and the stressors that people are experiencing, they don't go away. We know if people are exposed to family violence and sexual violence and all sorts of other abuses, that these things last, in many cases, people will carry them a lifetime. And so we are worried about the impact of that because folks will need support and treatment for quite a while, even as our communities go back together. So, we are certainly worried about that. And I would encourage us as a church to be thinking about that, to be praying for people in our communities, and to be supporting our neighbors. We've been fortunate in our community. We've really been reaching out to some neighbors around us, and we've found it to be an incredible blessing to have some distance across a fence, but to be able to listen to what they're going through. The financial insecurities, the difficulties they're having with their kids and in their parenting, and to be able to support them when we can. We try and drop off little things just to encourage them, right? We drop off some baking and some food, and try to support where we can. And I think those are really practical ways that we can make a difference in our communities. These are things that make us very uncomfortable. I think as neighbors, we're not sure what to say to people, but I would encourage those of you listening, if you're concerned about a neighbor, I would encourage you to ask them directly about what's happening. We need to go beyond, I think as Christians, we can go beyond the, hey, you doing okay kind of question, but to probe a little deeper, because there's a lot of fear and a lot of hopelessness, and a lot of concerning things happen. And if we can get those conversations going, we have a unique opportunity as Christians to explain the hope that we have in Jesus and the difference that can make in people's lives. So this is an important time of ministry, I think, for us as individuals and families. So I would encourage people to be aware and talk with their neighbors and colleagues about what's happening in their homes.
Mm-hmm. And so, Paul, thanks for bringing that up, because I think that there's, talking and asking appropriate questions is going to be one of the key things with regards to how this is playing out in people's lives. But I'm wondering if you can expand just a little bit. I mean, are there key indicators? Are there things that within our families or, friends around us, if we hear them, I guess, for a lot of people, they just don't know, like, when to be concerned in terms of seeking professional help.
Yeah, I think that's a fantastic question, Sue, and actually much more complicated than we think, because normally what we would look for is changes in behavior, something that seems different. So where we might see the kids playing in the yard, or we might see a neighbor outside the home, now we don't. So we might notice that somebody's missing, or we see somebody less, and that seems a bit off, or somebody misses work, and we think, oh, that's unusual that they wouldn't be at work. I wonder what's going on. Because we're all self-isolating, these things are a lot less noticeable to us. And so that is much harder to know how to interpret those things, which is why we have to, probe a little deeper sometimes and make sure that if there is a gut feeling that we're getting, and I think most of us, we get a sense if something's different or off with someone. And so we need to pay attention to that, because I think that's sometimes how the Holy Spirit lets us know that something is different with our kids, with our extended family members, or our friends and neighbors. So we should pay attention to those things and probe a little deeper. And then, especially as things open up, I'm thinking about a lot of children that are in vulnerable positions. A lot of the people that notice when something is a little bit different are the teachers and staff at schools and daycares and places where kids naturally get support. I'm thinking of a lot of kids who struggle. They don't have enough food at home, and they rely on some of those after school programs to meet their needs, and those are largely not happening right now. There's some great efforts going on in the city, but we know there's some kids that are still struggling. And so if we know that families are in those kind of positions, we should be making efforts to reach out to them and to minister to them in as practical ways as we can. So as things begin to open up, I think we'll start to see that more and more, and we'll start to see how things have changed and how people have coped or not coped, and we'll have an ability to come alongside them as Christians and to pray with them and to encourage them, both practically and spiritually. And that'll be a good work of ministry for us as a church community.
Mm-hmm. Mm-hmm. Yeah, very good. Well, that is actually probably a good place for us to wrap things up, because I think it is a call to the church, again, to be able to be the hands and feet of Jesus. And, that's our job, all of us, in our neighborhoods, our workplaces. And so I just want to encourage each one of you, just as a reminder, that all of the staff at West Highland are still available and working to serve you. And so that means that even the delivery of different care ministries is still happening, certainly differently, but it's happening. So, if you are struggling in any way, you can reach out to the church in terms of pastoral support, any of the prayer ministries, Stephen Ministry. Plus, we can also, in turn, if professional help is needed, we can turn you towards Paul, and also, some other resources in the city. So I just want to remind you that if you sense that you or anyone else that is struggling, there is still a lot of access to support through the website, as well as the telephone at the church office is still being manned Monday to Friday. So we would encourage you to reach out. Any parting words, Paul? Thank you so much for your time, and anything that you want to leave us with.
Oh, I appreciate it, Sue, and appreciate you and the team at the church, for all the ways that you support people, and also for paying attention to mental health. The church has struggled, I think, as a whole, not our church specifically, but the Christian church as a whole has struggled sometimes to navigate emotional and mental health issues, and I'm really grateful that our church has recognized that as something that's important. As we encourage people spiritually and practically and relationally, mental health is a part of our physical health, and it certainly is a part of our spiritual health as well. And so I appreciate that we've been able to connect this way, and certainly hope people have found it useful in some way. And I appreciate the encouragement for folks to reach out if they need support, because we are certainly trying to provide a variety of avenues for that. And I hope people will take advantage if they need it.
Okay, great. Well, thank you everyone for tuning in, and we appreciate your time and attention. And Paul, thank you so much for your work, both professionally and also all of your volunteer hours at the church. We appreciate it, and God bless.
Thank you.
Thanks, Paul and Sue, for that great conversation. I think it was really helpful for all of us. It was helpful for me to kind of understand why I feel the way I do sometimes after being on Zoom conversations all day. It's a good reminder to get up, disrupt our routines, do something physical. And I really appreciate the connection that was made between our mental health, but also our physical activity and our spiritual health as well. And that's all those things are really connected. And that's a good reminder for me today. If you've missed any of our other TREC sessions and would like to watch them, this was the fourth one. There's 3 other great conversations that we've had. They can all be found at westhighland.org/TREC. And our next TREC session is going to be with Tim Strickland, who's the Leadership Development Director with Feb Central, which is our denominational affiliation at West Highland. And I'm going to be interviewing Tim on the area of transformational leadership. And so I hope this interview will be useful for you. And I think it'll be useful for anybody who's in any type of formal or informal leadership. So I think it'll benefit everybody. So have a great week, and we'll see you again next time on our online TREC.